Mouthwash 101. Do you use mouthwash? If you do, why do you use mouthwash? There are different types of mouthwash for different needs in our mouth. So we want to make sure that we discuss today the couple different types that you can use and what their advantages are and how they can help you. Mouthwash is way too expensive to be buying if you don't know what you're using it for or what you need it for or what will benefit you. So let's talk about mouthwash 101. So there are different ways to clean your teeth, and mouthwash is just a good one to add to your normal brushing, flossing. Interproximal, those little brushes will help you clean between the teeth. But why do you want mouthwash? So let's talk about that. Most of us want mouthwash because we have bad breath. Bad breath comes from several different things. One can be the food that you eat. Garlic always gives us bad breath. Onions also as well. But if you have acid in the back in your throat, in your stomach coming up from your esophagus, acid reflux, that can cause an odor from your mouth. It can come from bacteria being in your mouth and under your gums that's not being treated and cleaned properly, and that can cause disease processes in the mouth. And so we want to make sure that you address the issues at hand and pay attention to what's going on in your body. Now, when we go to the drugstore, we find a big selection of mouthwashes and mouth rinses. And so, why do we have so many? I do not know. But they do, each mouthwash has its purpose and its intention. So, if you read the front of the label, it tells you it does several different jobs. And if you look at the back of the label to the active ingredients, you will see what it actually does, what it provides for you as far as preventing cavities or preventing gum disease. So that's what we want to make sure that you are being aware of and that you're being conscious of what you're buying. It's too expensive, like I said, to buy it and not know what it's doing for you or get what you want the job to be served. So let's talk about what kind of mouthwash do you want or need. So if you pick one, then you're trying to prevent cavities like we do in our children, even some of our older adults, and even if we are middle aged and we're trying to prevent cavities on the crowns of our teeth or our root surfaces, we want an anti cavity rinse. Some common names of those are Fluoride. That one's been around for a long time. Colgate Crest also make an anti-cavity fluoride rinse that can prevent cavities, and that is very important. Usually the same amount of fluoride is in the mouthwash that's in your toothpaste. So if you do run out of toothpaste, a helpful hint would be to just not rinse your mouth out after you brush. That can allow the fluoride to stay on your teeth and to benefit and strengthen and remineralize your enamel and root surfaces. So the other type of mouthwash that we would use would be an anti-gingivitis. So if we're trying to kill the bacteria that cause gingivitis or that cause periodontal disease, anti-gingivitis would be the one you would want to purchase. Some mouthwashes are worse about staining. Some will say that they whiten your teeth, and they do. Usually the ones that whiten teeth have the fluoride in them as an active ingredient. So those are some things to be on the lookout for. I wanted to share you a helpful hint that I tell my patients about. It's very natural. Most of us have it in our cabinets at home, and that is hydrogen peroxide. I like to use a mouthwash, and in my mouthwash, I will recommend patients a water pick, and I will have patients fill their reservoir up with water and then top it off with peroxide about once a week. And what this does is it delivers that antibacterial, so it's going to kill the bacteria, peroxide does, and it will go into the water reservoir, flush around your teeth, the gum line areas, and that will make you healthier and reduce the amount of bacteria that try to cause gingivitis and gum disease. Another helpful hint would be to take your peroxide and put your toothbrush in a little capful of it about once a week. That will help kill the bacteria that linger on your toothbrush head that we put in our mouth every day. So that's also good. Even if you have a UV sanitizer or the air does help to kill the bacteria, that will just be an added measure that can help you reduce the bacteria in your mouth. Well, I do